Hi, my name is Sissy, and I want to welcome you to my show, Getting Healthy with Sis. I am married to my hunky husband, Matt, and together we own a fitness and nutrition coaching studio in Lakeland, Florida called Restoration Fitness and Nutrition. We have 2 little boys, and I've been a nutrition coach for 5 years, helping countless people to revamp their lives and see amazing results implementing one healthy habit at a time. My passion is to help women just like me realize they don't have to be a victim to poor eating habits and poor health. Instead, through proper education and empowerment, they can take control of their health and live the healthiest and happiest life possible. As you tune into my show, I promise you're going to learn new things about your health. You're going to be inspired to take action towards your goals, and you're going to have a ton of fun along the way. Welcome to the Getting Healthy with Sis show. My name is Sissy, and today I have Dr. Tyler Love here. He is a local, he's a local in a Lakeland-ish native, okay? He is, I'm going to let him introduce himself, but he is a professor at Florida Southern, correct? In the physical therapy department. So he's training up students who want to become physical therapists. And he also owns Swan City Physical Therapy. So we're going to just be getting to know him and kind of asking him questions, picking his brain about all things movement and injury prevention today. But I want to encourage you, if you're listening to the audio of this, I want to encourage you to go on over to YouTube if you can and watch this episode, because I can probably guarantee you that at some point he's going to be doing something with his body or talking to us about posture and demonstrating that. So if you want to see the visual of this episode, you can go to YouTube at Getting Healthy with Sis, and you can watch this in the video format. But if that's not feasible, certainly you're going to learn things through the audio. So, Tyler, so you're from Lakeland area, right? Did you say Auburndale?
I am from Auburndale. Polk County.
Cool. Polk County.
Yeah.
That's awesome. That's so good. How long have you been a physical therapist?
So I graduated in 2013.
Okay.
So just over 10 years.
Okay.
Yeah.
Where'd you graduate from?
For PT school, it was Nova Southeastern in Fort Lauderdale.
Okay.
Yeah.
And then what was it that made you know, like, I want to pursue helping people with their bodies, with movement, with rehab, therapies, that sort of thing?
Yeah, so I guess it goes back to high school.
Okay.
My favorite class was anatomy.
Okay.
Right, and we had to learn everything about where the bones are and the muscles and everything. And I thought that was cool, and I knew I wanted to go into healthcare, but I was deathly afraid of needles.
Okay.
And anything like that. So my mom, actually, she had to go to PT after she broke her shoulder.
Okay.
And this was during high school, and she was like, Tyler, you should come shadow a PT and see what it's like. And so I took that opportunity, started learning more about PT, and realized there was no needles involved at that point.
Except now you do use
now,
some needles, so we can talk about that later.
For sure. And then just the whole, I had a background in personal training at Florida State.
Okay.
So I was a personal trainer there. So I've been in the fitness industry since about 2007.
Okay.
Everything kind of meshed well, from fitness to wellness to physical therapy.
Okay.
So as a continuum, I thought that was the best route.
Okay.
And it's worked out for me so far.
Okay. That's awesome. That's awesome. So just to backtrack a little bit before we kind of jump into your field of expertise. So you said that you're from Polk County.
Yeah.
So you've lived here your whole life.
Pretty much.
Okay. Tell me, just for the locals that are listening and watching, tell me this, you're married.
Yes.
And you have how many kids?
4 kids.
Okay. What are their ages?
7, 5, 3, 7 months.
Ooh, goodness.
Yeah.
That's crazy.
It's crazy household right now.
Does your wife stay at home with your kids?
So actually my wife, she's a CPA. And she actually works at Florida Southern as well. She teaches accounting in the School of Business there. So we're both at Florida Southern right now.
Oh my goodness.
Which has been great.
Wow. So you guys have help with your children.
We have some help with our kids.
Yes, yes,
definitely.
That's crazy. That's
yeah.
crazy.
And it ends up being a lot of my wife's students. who end up,
Oh, good.
because we know them, she knows them. She's like, okay, maybe
This is a good person.
She can come babysit. Yes. So that's been really
That's awesome.
helpful.
That's awesome. That's cool. Tell me, for our local Lakelanders, what's you and your wife, or maybe your family, what's y'all's like favorite thing to do, like in the area for fun?
Yeah. So as a family, it would be, we could walk Hollingsworth.
Okay.
Or we go to Bonnet Springs to the Children's Museum. If it's just like date night, we'll probably either go downtown, like 1961.
Heck yeah.
Maybe the Joinery. Always end up getting ice cream there. But those are kind of the hot spots that we'll go to here in Lakeland, for sure.
That's awesome. Yeah, that sounds kind of similar to me and my husband. Whenever it's date night, I'm like 1961. We haven't been in a few months, so it's super. Yeah. So 1961, we're giving you a shout out. You guys are awesome. So anyway, so you've got 4 kids. You and your wife are both working. You're currently a professor at not at Southeastern, but at Florida Southern. Right. And then tell us a little bit about how you ventured off and now like what you're doing currently with Swan City Physical Therapy. Yeah,
so I spent the majority of my time as a PT working for Baycare in outpatient orthopedics and sports med. And then I transitioned to Florida Southern about 2 years ago. And since that transition, I've always had a desire to have my own practice, but working for Florida Southern has given me the opportunity to kind of pursue that a little more. So I get to help students during the day, and then in the evenings I'm able to help the community in terms of treating patients and treating individuals who are active, who may have tweaked something, or maybe they've been dealing with like a chronic issue for a while and they just are wanting to try PT. So my position at Florida Southern has really given me the flexibility to be able to pursue Swan City Physical Therapy, which has been great.
That's awesome.
Yeah.
So what's the average, like what does the demographic look like of who you're helping? Like is it younger, older, athletes, non-athletes, or is it a whole mesh of different people?
I would say it's a pretty good mix in terms of age group. I've had younger individuals, middle school, high school, and all the way up to 50s and 60s. Typically, most of the patients I'm seeing are currently active somewhere, whether it be Restoration Fitness or another gym in the area, or maybe they've just been dealing with something that they sustained in sports or something like that. If they're currently still active in like an adult league, or maybe they're still in high school and they're competitive, or in college and competitive. So that's kind of who my target audience is, I guess, who I'm trying to get out to, because that's what I really enjoyed treating when I was working for Baycare and working in the outpatient clinic setting. Yeah.
So active individuals, possibly athletes, or people that are physically fit or trying to stay physically fit. That's awesome. That's really cool.
And I've had a lot of patients who they know that they have an issue, and right now they're not experiencing the pain, but they want to have that kind of guidance as to injury prevention at that level. So that's been really cool to have too, because in outpatient physical therapy world, that's not necessarily who we get to see. People wait until they have pain, and then they go and see their doctor, and then they go and get the image, and then they go to PT. Versus being proactive with healthcare, which is what we should be doing, is knowing your body, knowing that this thing may pop up, how can I mitigate that, and reaching out to a PT before it becomes an issue. So that's been really nice, a nice transition just from someone waiting for pain and then coming in. Yeah.
That's awesome. That's so cool. So you were talking a little bit about wanting people to be aware of their bodies and helping to mitigate issues before they come up. So how would someone, if someone is, so my husband and I, we own Restoration Fitness and Nutrition, and we are all about like setting people up for success for the long haul with their activity, with their nutrition, with their health in general, so that they can be healthy and thriving throughout all stages of life. And we actually, a large demographic of our members are people that are, 40, 50, 60. Their kids are a little bit older. They're not like you and I, like chasing little kids around. They have a little bit more flexibility in their schedules, but they typically, a lot of them will come to us and have some injuries. They'll be like, well, I've been in a car wreck, or I hurt my back one time at that CrossFit gym, so I'm super freaked out about weights and that sort of thing. And so how would someone know, like, hey, I'm having this issue? Like, how does someone know going to see a skilled PT might be a good preventative action step to take versus like, oh, I should maybe go see a massage therapist or a chiropractor, or maybe all three of those, like you, a massage therapist and a chiropractor mesh together. Like, how would someone know, I'm having like, say when I'm doing deadlifts, I'm having like this weird pain in my lower back that feels really tight.
Yeah.
And it's making me not like want to come to the gym because I don't know what it is. Like, how would they know this ailment is going on in my body? I should maybe reach out to a PT or reach out to Tyler or something like that.
So, I mean, I would say being in tune with your body is number one. So if you know something's out of the ordinary, because let's say that they did a lift in the gym and the next day or 2 days later, they feel it. It's not normal what they feel, but they feel something. The problem would be if they continue just going back and doing the same exact lifts.
Well, tell us why that's a problem. Tell me why. You're feeling something pull or real tight in your lower back when you do deadlifts. Maybe you've gone to get a massage. It didn't really help, but you don't want to quit coming to the gym, so you keep coming. Why is that a problem?
Yeah, so if we stick to the deadlift example, let's say that you felt something in your left lower back. There could be something going on in terms of a muscle imbalance or a positional fault. So in PT, we do assess posture and we look at muscle strength, but we're also looking at alignment of the hips.
You right?
And we're trying to see if there's an asymmetry there. And maybe that could be the reason behind why you're feeling what you're feeling there. So we try to diagnose in terms of figuring out, is the left hip in this position versus the right? Is the left musculature in the left front of the hip different than the right? Is that an issue? And then we work up the chain, and we could look at the SI joint. We could look at the lumbar spine. Where the lumbar spine articulate, we can see if there's any joints stuck. Maybe they need to be opened, they need to be moved. All of these things you don't necessarily think about, but you know that there's a signal there. And so the signal is that individual's cue to probably go get it checked out. Discomfort. Yeah.
Discomfort is a signal that we should listen to.
Yeah.
Correct?
Yeah. Increased stiffness, prolonged soreness, sharp pain, a discomfort with movement that normally wouldn't cause discomfort.
Okay.
All of these things are just your body giving you a signal to say, hey, something's up. And maybe that goes away over the course of a couple of days or weeks, but then you go back and you do the same lift, and then there it comes again. And let's compound that over months and years, and now you're going to the doctor and you're getting an image and you're getting it checked out, and you're going through all the channels where if we could have just all the way back to where you started feeling something that wasn't right, that could have been maybe, postponed, or we could have looked at the issue and addressed it there, and then not had to go all the way down that route.
And your muscles, and you can correct me, and you're the expert, so your muscles have memory, and so if they're used to being moved in a limited way, or they're going to get used to that. And then you've got, where we might need to correct some posture where your muscles are now pulling on your bones in a way that's getting you out of alignment, and it's just compounding the issue.
A great example of that I see a lot are patients with neck pain, especially chronic neck pain. So one of the things I look at is rotator cuff strength.
Okay.
So if you have weakness in your right rotator cuff, you're going to have overactivity of your upper trap.
Okay.
That upper trap attaches to your neck.
Right.
If it becomes overactive over time, and we think about the muscle memory, its muscle memory is go, go, go.
Right.
And the weakness in the rotator cuff is low. It's not working as well. And now you have this upper trap compensatory pattern that affects the neck and its mobility. It affects the shoulder and its mobility. And it affects a lot of things in terms of the shoulder blade position. And that can lead to either neck pain, a shoulder pain, a mid-back pain. But it all stems from just not having a solid, stable, strong rotator cuff muscle.
Because everything is compensating.
Exactly, 100%.
Yeah.
I see it all the time.
Yeah. Okay.
So, yeah.
That's so good. So, our listeners, one thing that you would say is like, hey, be in tune with your body. I always, I have healthcare practitioners and doctors tell me all the time, that I am so in tune with my body. Like, I pick up on, I'm like, something is not right here. But it's so good because I can pick up on even, I ate this and my body feels like this, and I can pick up on it so quickly. Or I did, but it's so good to be in tune, and you don't want to be like a worry wart or, hypochondriac. But
Yeah. Because you know your body.
Yeah.
Yeah, absolutely.
Yeah, and to not just discard it. One of my favorite things to talk about as far as health and nutrition is like, if you were to buy like a brand new Mercedes, like you're not going to go put crap gas in it and break it down. Like, I think a lot of times we hesitate spending money on our bodies.
Yeah.
But our bodies are like what carries our soul and our person. That is what's alive. That is what we have to give away in this life. And so our bodies are broken down like it's...
Yeah, you should be a good steward of your body, right? You only have the one body.
Right.
So you should invest in it.
Yes,
right?
100%. Well, speaking of that, so, okay, one thing that I love about your practice, which I think is really neat, is that I think sometimes people have this, they're like, dadgummit, I've tweaked my back and I don't really have time. I don't want to go to get an MRI. That's going to be $500 and I have to do that before they recommend me for PT. But tell us a little bit about how your practice is a little bit different than that.
Yeah. So, I mean, my wife and I deal with it with our kids, taking them to the pediatrician.
Right.
And we're slapped with a bill, and if they need any special tests, we got to go do that. So insurance presents a lot of challenges. So my practice was set up out of network where I don't take any insurance whatsoever. The benefit to that is there's no requirement for me to get a referral from a physician.
Right.
In the state of Florida, I could see you for up to 30 days without any type of referral.
Okay.
And what's nice is that I can see you quicker. I can get to where you're at, maybe if it's at your house, or just to make it more convenient for you. Because I understand, I've had patients and they have 3-4 kids.
Yeah.
And getting to and from a PT clinic can present its own challenges.
Yeah.
Who's going to watch the kids?
Right.
Right. And you're taking turns doing the whole thing with like, oh, my husband's got them now, but then all of that, like I've heard that plenty of times. I guess my philosophy would be with Swan City PT is being more concierge based, being able to meet the patient where they're at.
Right.
And trying to be as flexible and accommodating as I can be.
Right.
So, if I had a patient that was busy during the week and they could only be seen on a Saturday, I can do that.
Right.
Like, that's not a problem.
Right.
It's nice to be in control of the hours and then also the green light just to get them going.
Yeah.
So
if someone contacted you, they've got an ailment, they can just get right in.
Yeah.
And they can see, you can treat them for 30 days without a doctor's referral.
Right.
So would you say, hey, let's try to get in like 5 sessions this month? Like, would that be a kind of a normal thing, or once a week,
Yeah.
or what are you? Does it depend on their injury?
Yeah, so a couple of things. It could depend on their injury. One thing that we push in traditional PT, when a patient comes in, we kind of set up a plan of care, and the plan of care could be 1 time a week for 6 weeks, 2 times a week, and just so on and so forth. My approach is different. I don't necessarily like that. So I'll end up just contacting my patients 1 or 2 days after treatment, their initial treatment, to see how they're feeling. And that gives me a better idea as to, okay, yeah, we need to probably see them maybe once a week or maybe even twice a week for the first week, just to see if we can jumpstart. But if they're doing well and, things are progressing without me having to actually do something and they're doing things on their own, I can back off and I can say, how about every other week? let's pursue that, which is nice because that's not necessarily the model that we can have in traditional outpatient physical therapy.
Sure. So it's more cookie cutter there, whereas you can kind of be the leader of like, this is what I'm seeing.
I have more
this
autonomy.
is what I'm.
There's more autonomy with this,
Yeah.
which is nice.
That's really
and it's
cool.
nice having that relational aspect with the patient, to be able to contact them 1-2 days after to check in on a weekly basis to see how you're doing. Because that's what I would want from my healthcare provider.
Right.
If I had ease of access to contact them, and if I had a quick question or a quick concern, just a little text message here, I feel like that's really valuable.
Right. 100%. That's awesome. That's so cool. So you offer like the consultation where you're going to check out their body, check out their ailments, assess what's going on, and give your best assessment there. But then, tell us a little bit about what you're providing as like the modalities that you use and things like that.
Yeah. So traditionally in PT, we have hot packs, cold packs, electrical stimulation, ultrasound. I'm not a big proponent of those things. I don't have any of that stuff.
Okay.
What I do like to do in therapy is if there's a mobility issue, a flexibility issue, something stiff, something's not moving, for example, the shoulder, I typically will do manual therapy, which will include hands-on treatment, trigger point release, something that's called like tack and floss, where we have mobilization with movement, and then scraping, the instrument-assisted soft tissue mobilization, cupping, and then what I've been doing a lot lately is dry needling. And that's been
Tell us about that. I feel like that's like on the up and up, and like tell us a little bit about it. Because it's needles, and you said needles. You didn't like needles.
I don't like needles, but I have a new appreciation for needles now.
Right.
These needles, we don't inject anything. They're actually the same needles that you would have at an acupuncturist. The differences between acupuncture and dry needling, there's a lot of similarities, but there's differences. Eastern medicine versus Western medicine. So if you were to come in with pain in your neck and maybe in your upper trap, I would address that with the needle. I would try to find trigger points. Okay. And what's interesting is that the trigger points actually line up really well with the acupoints. So the acupuncturist, they've been knowing what's going on for a while.
And that's Eastern.
Yeah.
Okay.
And that's been around for a very long time.
Right.
But what we're doing is just we're pushing the same needle into the muscle belly or around nerves or towards the bone, and we're trying to find these trigger points, and then we can also leave them in and connect an electrical current to those needles, and push an electrical current through the muscle, and try to relax the muscle. Let's say if your upper trap was really tense, that can help alleviate some of that tension, and that would improve either shoulder mobility or neck mobility. It also helps with the healing, helps with the blood flow to the area. So like, let's say a chronic type tennis elbow, right? So tennis elbow, we can have pain on the elbow, but there's not really any inflammation happening right there after weeks of having this symptom. You could have tennis elbow for months and months. What the needling does is it goes into the tissue and it disrupts it and actually promotes some of the healing factors to kickstart. And that can help with the pain reduction. So it's a really cool modality that I've been incorporating a lot with my treatment, and I've seen a lot of good outcomes with it.
Are the needles, do they present as almost like a type of like tiny injury?
You're right.
The body's like, oh,
you got it. Yeah,
let's pull blood here.
Micro trauma, right?
Okay.
So you present micro trauma to the tissue, and then it upregulates the inflammatory cascade that helps with the healing process.
That's really cool.
Along with that, we got to load the tissue. So whether that be isometrically loading or eccentrically loading, but the manual therapy, dry needling is just one piece of the puzzle. We got to also address any muscle imbalances, whether that be stretching or strengthening motor control. So that's what the treatment looks like.
That's cool.
Yeah.
So you're kind of offering a, Susie is 50 years old. She's on the tennis team. She's got tennis elbow, or she's having chronic issues, pain in her shoulder or whatnot. You're offering that. Do you ever do stuff do you ever do therapy with like someone that say has torn an ACL and like you are going to see them through that 3 to 6 months of therapy? Do you do that type of recovery? Hey guys, I hope that you're enjoying the show, and I wanted to interrupt real quick just to invite you that if you are listening to this podcast on Apple Podcast, I would be so honored if you would go up in the top right-hand corner of your app and click the follow button. Then if you will scroll down and rate and write a review on the show, that would just make my day. I would love to hear from you, hear how the show is impacting you and how you're enjoying it. And with following the show, you're going to get notifications of every time I release a new episode. If you like to watch my show on YouTube, then I am inviting you to subscribe, like, comment, and share. Tell me what you're liking. Share this with your friends if you think that they can benefit from it. So I appreciate you listening in, and my goal is that this show will edify you and encourage you on the way to better health. So if it's doing that, then I'd love to have you along for the ride by subscribing, liking, sharing, following, commenting, reviewing, all the things that would make my day. Are you seeing any patients that say have torn their ACL?
Like a post-op patient?
Yes. Yeah. Are you seeing any patients like that?
So I haven't yet. The reason why is...
You haven't yet in Swan City.
At Swan City. Yeah.
But when you're practicing before at daycare, you probably did that a lot.
All the time. Because we were dealing with a traditional insurance base where they have a copay of like $20 and they're coming in 2 to 3 times a week.
Right.
Which is very appropriate for a post ACL reconstruction or a post total knee replacement. In fact, I just had a patient reach out to me 2 days ago. I'm not sure how they got my information, but they were asking about PT, and I said, well, what's going on? He said, I just had a total hip replacement. And I said, oh, hold on. Like, I would love to see you, but you can go to this clinic, this clinic, this clinic, which is a more traditional insurance-based clinic, and be seen 2 to 3 times a week, and cost effectiveness is so much better for that individual.
Okay, because you're not taking insurance.
Right. And so
I got it.
As a human being, I want them to get the care but not charge them an arm and a leg for that.
That makes sense.
So for like post-op ACL reconstruction, I haven't gone down that route or seen any post-operative patients, like a post-op rotator cuff repair, because I feel they could go to a traditional PT clinic and receive great care. And there's plenty here in Lakeland.
That makes sense.
And move through that early phase of rehab.
Yeah.
Now, what I have seen are some individuals who've had, let's just say with post-op ACL reconstruction, months down the road. They met all their goals in PT, traditional-based PT, but let's say they're a higher level, high-frequency tennis player, and they're going out and they're just noticing when they cut, the quad strength isn't there. They're getting a little tenderness and pain in the front of their knee, and they want to get a little more PT. That's where I can come in.
Yeah.
And that's my bread and butter there.
Yeah, that makes sense.
Yeah.
So it's not so much like the post-op, like you need 6 months of therapy. It's the little more acute, like I'm having this issue. Could you help me for a few weeks or a couple months?
You got it.
Okay, that's cool. So I'm thinking about when I was 16, I was a big-time basketball player. Basketball was my sport. I loved it. I thought I was going to be like a professional basketball player, even though I'm like 5'3". I mean, like, the dream was big, okay? I loved basketball. Now, my husband always gets onto me because I literally hate watching basketball. I don't like watching basketball. Anyways, I would much rather watch like college football or something like that. But I loved basketball. When I was 16 years old, I was playing in a 3-on-3 tournament in the middle of summer. I had previously had my jaw operated on about a month or 2 before, so I was deconditioned. I had been laying up in bed all summer, played in the basketball tournament, and a girl came driving in, and I was like, heck no, you're not about to get a layup. I went up hard on her, and I was very aggressive. I went up really hard on her, and I was thinking, oh my gosh, I went up so hard, I don't want to clobber this girl. Like, that was what I was thinking. I'm not trying to just like totally like destroy you in the concrete. So I went up hard, and I thought in my brain, make yourself skinny and get up off of her. And when I did that, I think I straightened my legs out. and I tore my left ACL when I came down.
Oh, no.
Now, I was an very active athlete all growing up, and I had sprained like my ankle 16 different times, but I had never felt a pain like when I tore my ACL. I mean, that was excruciating. So I tore it, had it repaired, went through, this, at that point it was 6 months of physical therapy twice a week. I was very diligent because remember I was going to be a basketball star,
of course. Yes.
Had to get back to it. And so did that, got the big Don Joy brace.
Oh, yeah.
Okay. Do they even do those?
Yeah, they still come in with braces, yeah.
Yeah, okay. So I got the big brace, that was supposed to keep me good, and was cleared through physical therapy. And so I missed my junior year of basketball because of that. And then I came back my senior year, and the 5th game of the season, I tore the same ACL, wearing my Don Joy.
Yeah.
So what happened?
Well, we could talk about ACLs.
Let's talk about it.
So much. So I cannot remember the exact percentage, but the longer you wait post-op ACL reconstruction, your incidence or your risk of re-rupturing goes down significantly.
The longer you wait to have it repaired?
The longer you wait after your repair.
After your repair to what?
To
get
go back
active?
to go back to sports. Yeah. Yeah. So if you rush it, it's significantly higher risk of you re-rupturing it.
Huh.
Yes. I know.
Interesting.
Yeah. I know we got to talk about this again in depth so then I can present you with like the updated stats because I've heard this story many times.
Do you hear it more in females?
Absolutely. Yeah.
Because one of the things that I had heard was that naturally, like our anatomy, our knees go in.
Yeah. So
when we jump.
hips are wider.
Yeah.
And then so the knees come in. And then typically females will land with a stiffer knee.
Yeah. And that's exactly what I did
so
the
that
first time.
non-contact ACL rupture is super common in girls.
Yes.
Soccer players especially. And there's a lot of research behind all that. But if you go through rehab for 6 months and then at 7 months you test out, you go through the HOP test, you go through.
Yeah.
There's actually a lot of other evidence in terms of psychological questionnaires.
Yeah.
To see if you're also ready there.
Yeah.
And then strength testing, your hamstring versus your quad ratio, right versus left. If you still get back to it too fast, the risk of re-rupture is very high. So the longer you wait, like each month, it drops down percentage-wise. So, yeah, it happens.
Well, they did a hamstring graft on me. So they took 2 out of 4 of my.
So they took a hamstring graft,
Or-
they put that in there,
Yeah.
made your new ACL.
And now what do I have? I have a weaker hamstring.
So you re-ruptured it the second time, and then you had a hamstring again, or what'd you have?
I was
cadaver?
a senior. And my hopes for being like the college basketball star, they went out. I wasn't going to go pro anymore.
Yeah.
All of these things interrupted my plan for my life. I say these things all joking. I'm a 5'3" white girl, so it probably wasn't going to happen anyways, but I thought it could. But because it was my senior year and I'd already missed my junior year, and now dadgummit,
Yeah.
I've torn my knee up again. At that point, my doctor said to me, he said, listen, if college sports are not on the table, he said, you can re-strengthen this leg and you can go on with your life. You can run a marathon on a torn ACL.
Yeah.
You just need to strengthen it. If you're not going to be playing competitive sports anymore, you'll be fine.
Yeah.
And at that point, it had been so recent that I had gone through the surgery that I was like, I'm not about to do this again in my senior year of high school. I'm not going to do surgery again. And then that's like what I'm going to do the rest of the time I'm in high school is repairing this for what? Anyway, so I decided not to repair it again.
So you would be considered a coper. So whenever someone tears their ACL, they can either rush and go get a reconstruction or a repair, because they're different. Or they can hold off and wait, and there's some tests in terms to see if they are a coper, meaning they can cope without an ACL. And then they actually looked at the copers versus the ACL reconstruction groups. And I want to say like a year or 2 years, they look at where they're at outcome-wise, and they're very much similar.
Interesting.
Yeah, which makes you wonder, like, are we doing ACL reconstructions too often?
Right.
Is it kind of like the crutch what we go to?
Right.
Kind of like we always would go to ice immediately.
Right.
So we'll see what the surgeons end up doing, in the next 5, 10, 15 years.
Which, at that point I knew I actually did wind up playing. It was a kind of a surprise. So I did play tennis my freshman year at Southeastern. I played on the tennis team at Southeastern.
So did you wear a brace?
No, I didn't.
You didn't?
But I had to be I was just very careful. And after I tore it the second time, I just kind of knew, like, hey, you've got to kind of back down off of this competitive thing. You're now injured, and you can't just be a maniac when you're out playing sports. So I kind of had to temper my mind back. But obviously, like, I do tons of squats. I do box jumps when I'm not 6 months pregnant.
Yeah.
I've done that for years and have been fine.
So you've still been getting after it.
Oh, yeah, sure.
But I want to go back to what you said in the very beginning, was that you had sprained your ankle like 16 times. So what's interesting is that the thought of inter-regional interdependence or regional interdependence, where let's say you sprained your ankle, right? And it was the first time it probably blew up and it was really swollen and painful.
Oh, yeah.
And each time after that, it probably didn't blow up and get as swollen. But originally when you sprained it, it may have altered your movement patterns, meaning you weren't maybe using your gluteals on that side nearly as much for stability. And you kind of just kept going that route.
Right.
And you never really addressed that, like in terms of the hip or the core musculature.
Right.
And that may have, again, we're just speculating, contributed to that future ACL injury.
Right.
And that's something really interesting to think about whenever you're trying to, like, get ready to get back into fitness. What injuries have you had before? How did that affect you that you don't even know about? Like, you sprained your ankle and you know it hurt and you know it's better now, but you're prone to roll it.
Right.
But what other muscle imbalances up the chain you may have that may contribute to a future injury?
Yeah, and I think what you bring is so interesting, because being a health coach, and obviously this is a passion of mine that I'm so interested in, is helping people holistically with their health. And it's just something, it's so easy, like, in our, like, Western thought, is to just, like, compartmentalize. Just like, well, I just did it because it happened.
Right.
Well, it's like, well, no, that ACL is connected.
Yeah.
It's connected to everything, to your, back up to your hip, to your ankle, to everything is so connected. And so, it's not to make us paranoid, like,
Right.
I have to be moving perfectly and I might have injuries I don't even know about. Like, we can't be paranoid, but being cognizant of, like, hey, I don't just need to, like, beat up on my body and then wonder, like, why is it doing, like, everything's connected.
Sure.
My quadricep is connected up into my hip, and which is connected to my lower back, and everything touches.
Yeah.
And so it's all connected.
The PT students that we have in our school of PT, they have the same thought process where it's a knee injury, we're going to work the knee, and we're going to work the joint above and below, but we may need to go further than that. So where we step in as professors is really, you got to look at the whole individual. You can't just stop at where the pain is, or maybe just a joint nearby. Right. Because there could be other contributing factors. So we preach that in PT school. We, as PTs, that's what we should be doing, looking at, the entire individual. And I think that really exposes a lot of asymmetries and deficiencies. And if we address those, maybe we can work on the injury prevention, or maybe get them out of pain, or hopefully making them more durable so they don't cause any issues in the future.
That's good. That's good. So treating the whole person, and not just a specific
Right, and psychologically, because what I've noticed a lot whenever I was working in my traditional insurance-based clinic was these athletes that come in that are high-level athletes and they want to go D1. They're high school now. They tear their ACL. What a blow psychologically, right?
Oh yeah, it's devastating.
And so
terrible.
you got to work through that. So PT becomes therapy, physically, but also mentally and emotionally, and kind of trying to put ourselves in the patient's shoes and how devastating that is.
And if their worth is wrapped up in their sports performance,
where is their identity, right?
Yeah, then it's really devastating.
Absolutely.
For sure. It's life altering. Yeah.
So the early phases of like an ACL reconstruction is hang with me. These months are going to be rough. We're going to get you going again, though.
Right.
It just takes time.
And then you need to take a year off so you
and
don't re-rupture
it. Don't rush back to it. So.
Right. That's good. That's good. Well, I remember when we had you back in July, we had you come as a guest in our gym to kind of do a little workshop for our members. And one of the things that you said that really stuck out to me that I think is so important because it's something that we really emphasize with our members, you said you were talking about the need for movement and how living a sedentary life is like a number one risk factor for neck and back pain and injury. Is that right?
Yeah, so it's one of the bigger risk factors that can lead to degenerative changes or progression of those changes in the spine for sure. So if you can mitigate the amount of time that you're sedentary, i.e. get out, get physical, even if it's just walking, it's definitely better than nothing at all. And even if you have pain, if you can walk and still be able to do that activity without increasing pain to where it's super high, you should do that 100%.
Yeah. And before we kind of got started today, you were talking about the importance of not staying like in the same position all day long.
Right.
But like if you're always doing this,
right.
think about, okay, let me change my position. Talk to us a little bit about the importance of like moving your body positionally.
So, posture doesn't necessarily correlate with a pain. A sustained posture or prolonged posture may cause some ligamentous changes, some muscle changes, so especially loaded. So if we just think about everyday life, we should be able to go into any posture we want to and then come out of it. That would be normal. The abnormal would be staying in one posture for an extended period of time, and then over time not being able to get out of that posture.
Okay.
So one of the main postures that we see, especially in the older population, is forward head, rounded shoulders, that mid-back thoracic spine is pretty curved. Getting out of that, it's fine to go into it, but can you get back out of it, and then can you shift back into a different position? And that's what we want people to be doing all the time, not just in one position always.
Right.
So kind of that intermittent posture versus prolonged posture
For sure.
mindset.
For sure. And kind of hopping back to the movement in general, I've had a client, say to me before, what is it with the whole, is there a magic number, like the 10,000 steps a day? Is that like some magic, that's what you hear, like shoot for 10,000 steps a day, in which we preach that. I preach that. Or if it's not 10,000, find your baseline and try increasing it by 1,000 to 2,000 steps a day. That's going to be about a 10 to 20 minute extra walk a day. It's going to make you just that intentional movement of, hey, let me actually go out and move my body a little bit.
Sure.
But I've had a client, say, I don't even really know if there's anything to that whole, like, what's so magic about 10,000? But like what I hear you saying is it's not really that step count. It's that you were that in motion. Correct?
Yeah. So being
it's a way to measure how much motion was your body in today. That's one very practical way.
Yeah.
Correct?
Yeah, I think so. Absolutely. If you think about your typical desk job and you're sitting in one position for 6 hours a day, and the only time you get up is to maybe go to the restroom.
Right.
I mean, that's a lot of time to be in one position.
Yes.
Versus getting up and moving around, changing posture, getting the blood flow.
Yes.
Not only that, if you think about, we adapt to outside forces, right? So, our muscles get stronger, but our bones get stronger. So, we want to make sure that we have some impact, whether it be just walking, maybe a light jog, whatever that individual is at that time in their life, to be able to add a little bit of extra load. And it doesn't have to be anything extraordinary, like coming in and doing, 400-pound squat.
Right.
But it could just be going up a flight of stairs. Like that would be load for someone maybe at that stage in their life where they just have been really out of shape or they haven't been getting in the gym.
Right.
So a lot of
Starting
cardiovascular effect, a lot of joint effect, muscular effect. There's so many good things.
Right.
Just you got to move.
That's
At the end of the day.
yes, so important. And I remember one of the things that you said when you were teaching at the workshop that was a big takeaway for me was, like, if you think about, like, you have 24 hours in a day and say there's 7, there are 7 days in a week. You multiply that out, it comes to, I did the math. It's 68 hours or something. 168 hours, I remember.
Nice.
And say you came to the gym 3 of those hours out of your week.
A small percentage.
Okay?
Right.
You were sleeping 8 hours a day for times 7. So you're laying in your bed asleep for 56 hours. You're sitting at your desk working for 56 hours. And then you can only move for 3?
Right.
Okay, we got to figure out how to get more movement in, instead of just like, I went to the gym, now I'm just going to sit on the couch the rest of the day, and I did my workout. Yeah. So that was something that really stuck out to me, is actually looking at your week. How many hours do I have? How many hours am I sleeping? How many hours am I sitting at my desk? Okay, now I've got like 50-something more hours. What am I doing? Yeah. Am I in motion or am I sedentary in those hours? That was something that I thought was really cool.
Yeah, and the way I look at it too is if someone's coming to PT and they're being seen twice a week for 45 minutes each, like, you've got to do your stuff on your own. Like, you've got to work on mobility and flexibility. You can't just rely on a couple visits to make substantial progress. Right. Which is something I've always kind of preached to our patients, because we're not seeing them. We're seeing them for a fraction of their week. Yeah, that's really good. So
has heard about logging food, or you have had a friend that's logged their food and they've seen great and amazing results, and maybe you're a little curious about it, and you know deep down, like, if someone could just show me how to do it and teach me how, then I could be set on my way and I could be off, getting these amazing results that I've seen other people get. Well, that's why I created this course. In this course, you're going to get the hand-in-hand instruction from me teaching you exactly how you need to calculate your macros, how you need to log for efficiency and effectiveness. I'm going to be showing you all the sorts of tips and tricks that are going to make logging easy and effective for you. If you are a current nutrition coaching at Restoration, or you join nutrition coaching at Restoration in the future, then you will get this course added into your nutrition coaching package for free. So that's an amazing perk. You'll get it. You'll be able to watch all of the video tutorials and get that hand-in-hand instruction from me that way. So again, if you want to purchase this course today and get started today on your logging journey and start working towards your goals of fat loss and muscle gain, then I want to encourage you to go to my website. It's gettinghealthywithsis.restorationfitnesslkld.com.
All right. Well, I feel like we've gotten some really great gold nuggets. Thanks for sharing the gold.
Absolutely.
Yeah, I really appreciate it. And I feel like kind of some of our big takeaways is, number one, you talked about mitigating issues before they become really bad and really tuning into your body and listening. And so I want to encourage you, if you're in the Lakeland area and you're like, I have been having that persistent issue and I've been ignoring it, like, you can totally reach out to Tyler. We're going to put his info in the show notes so you can know exactly how to reach out to him and connect with him. Like he said, you can text him or call him today and he can probably fit you in this week. So that's that's the flexibility and the benefit there. But mitigating issues before they become prolonged issues that then you're having to unravel a lot down the road.
It's so much easier to treat something early on versus waiting. And then there's a plethora of other things that have happened along the way.
Yeah. And then just, understanding one muscle group is connected to another muscle group. We're not just talking, if you've got an issue in your shoulder, there's other things going on. So everything is connected. And then my favorite one as a nutrition coach and as a coach here at this gym is movement. It's so important. Even I'm 6 months pregnant right now, and with 2 small children that exhaust me half to death, but I'll get out on my patio in the morning and I'll just start lifting my legs up. And I'm like, this is the dumbest old lady movement, but like, I'm moving my body right now.
That's good.
I'm working my hip flexors, my abdominals, my legs. I'm doing some grandma squats. But those little things, they matter. They matter. And so I thank you so much for coming and sharing with us, and just want to encourage all of our listeners, if you need Dr. Tyler, like right now, you can reach out to him. Again, like I said, all of his information will be in the show notes, and that's when you go back into this podcast episode, or if you're watching on YouTube and you just scroll down, you'll see his info down there. But, if you save this, if you need him in the future, you can remember and come back or reach out to us at Restoration, and we can get you in touch with him. So thank you so much for coming.
Thank you for having me.
It's been a pleasure to get to interview you. And if you are listening and you're enjoying the show and you're listening on Apple Podcast, I want to encourage you to go up to the right-hand corner of your screen in the podcast and click the follow button. When you do that, you'll subscribe to this podcast, and then you won't miss a single episode that we release. So you'll be notified every single time that I release a new episode. And then if you're watching on YouTube, then I want to encourage you to subscribe to the channel, like it, comment, leave me a review if you're on Apple, leave me a comment if you're on YouTube, and as always, share. Share the episodes with your friends and your community if you feel like this is something that would benefit them. And without further ado, we'll close things up, and I thank you for coming.
Thank you.
All right, we'll see you later. Bye.